speakers to move through reasonably quickly. Okay.
Hi, lovely to speak to everybody. Can everybody hear okay? Okay. So we are a team led by Professor Susan Scott, co-tutors are Dr. Matt Mulgar and myself, Moira Doolan. And we also have a team of practice tutors. Just want to say that Stephen and Matt will send their apologies for today. Couldn't be with us. Okay, so conduct problems is I think what we're trying to treat here. And I think it's just helpful to remind ourselves that they are the most common referral problem across health and social agencies. And also they're tricky because they're very commonly comorbid with a whole range of difficulties. Therefore, treating them is a complex business. Crucially, a child with conduct problems is going to be affected in all areas of their life, and the problem can be, as we know, lifelong. So finding effective intervention at this stage in a child's life is crucial. And in order to be successful in treating them, we need skilled practitioners who can both assess well and provide effective treatment. The reason that group and individual parent training programs based on social learning theory are being provided, the training in them, is because they are the treatment of choice for this problem in younger children. And the new NICE guidelines really emphasize this point. And that also there's an overlap in terms of the programs that can be used effectively for treatment of ADHD, which is so commonly comorbid with conduct problems. So what does our training include? First of all, training in assessment and formulation of the difficulties. They get training in the Incredible Years Group Parent Program for both younger and middle-aged children. I've chosen because of its substantial evidence base in England and Wales as well as internationally. Training also in an individual program, because we know that not all families will attend groups, but also because of the complexity of the issues, sometimes it's helpful to have an individual family approach. There are really considerable service development considerations, and this is part of service transformation. And I think, I know that some of the services in Wave 3 already have got well-developed services, and they will understand, I think, well what I'm saying here, because it is a significant and often novel service development, because it does require change in delivery practice. Families may be socially disadvantaged and therefore require a sort of outreach and home visiting, and that's an important factor. The new NICE guidelines recommend that we need a workforce skilled in complex mental health assessments and evidence-based interventions. There needs to be integrated services, delivery of services, and I think that what we were seeing across the kind of variety of people involved in the partnerships now is helpful to this. They are focusing on entry, not exclusion, and providing multiple points of access and service. And then I think also crucially, being able to provide things like creche facilities, assistance with travel, and advocacy. All of these things need to be factored in service development now.
Thank you very much.